Good afternoon. I am Tamika Glover. I am one of the Black History Committee members at the New Jersey Department of Labor and Workforce Development. It's a pleasure to welcome you to our second Black History Month program for 2022. This year, our theme is Black Health and Wellness. And today we have another exciting program for you. Health is wealth. So we have three distinguished panelists who's going to give us their insight and their expertise on how we can do better, how we can enhance our well-being. We have Dr. Cedric McFadden, Dr. Cheryl Yarborough, and Dr. Michael Amew. And before we start, we're going to go forward with our invocation by Marcina Benson.
Thank you. Oh, Heavenly Father, we thank you. We honor you. We praise you, for you alone are worthy to be praised. We thank you for allowing us to celebrate and acknowledge the African American experience. We thank you, Lord, for your presence through our struggles and through our happiness. We thank you for our ancestors who have paved the road and opened many doors for us. They are so precious to us, oh Heavenly Father, and we deserve to mention just a few of them. People such as Nate Turner, Phyllis Wheatley, Harriet Tubman, Martin Luther King Jr., Marcus Garvey, Malcolm X, Carter G. Woodson, Barack Obama, the Tuskegee Airmen, just to name a few. Father God, and there's those that go unnamed, such as those who've traveled here on the Amistad, or those who have labored in the fields. Lord, we know that there is still much that needs to be done here, but we ask that you order our steps so that we can be more like you, to love one another and to live in peace and harmony. Father God, we ask for your continued presence here and also your grace and mercy. We ask you these things in Jesus' name. Amen.
Amen.
And now we'll have the National Black Anthem by Letitia Clark.
Good afternoon and welcome to the Black History Month program. If you know this song, you can sing along. Lift every voice and sing till earth and heaven ring. Ring with the harmony of liberty. Let our rejoicing rise high as the listening sky. Let it resound loud as the rolling.
Thank you, Letitia. And now I have the pleasure of introducing our moderator for today's event, Mr. Brahim.
And thank you for those kind words, Tamika. And thank you to members of our audience for joining us today for our second NJDOL Black History Month presentation. My name is Brahim Knight, and I'm the Diversity and Inclusion Officer at the New Jersey Department of Labor and Workforce Development. I am joined today with an esteemed panel of guests who will address issues affecting the Black community with an emphasis on Black health and wellness. Our panelists are licensed practitioners in their respective fields of study and bring their lived experience to our discussion today. I hope you find the next 60 minutes insightful, educational, and you leave today's session with some tools and resources which benefit you, your families, and community. Our discussion today will focus on the National Black History Month theme, focusing on health and wellness. This theme underscores the rich legacy of everything from Black scholars, medical practitioners, and midwives to more recent initiatives focused on mental health for people of color. So with that as a backdrop, let me introduce our panelists of guests. First, I would like to introduce Dr. Cedric McFadden. Dr. Cedric McFadden is a surgeon, speaker, writer, and mentor. He is a board-certified colorectal and general surgeon and teaches as a clinical assistant professor of surgery. He treats a wide range of disorders of the large intestine, including colorectal cancer, inflammatory bowel disease, ulcerative colitis, and Crohn's disease, diverticular disease, and hemorrhoids. He performs colonoscopies, minimally invasive surgery, and robotic surgery. He has nationally lectured to hospitals, civic organizations, churches, and community groups. Dr. McFadden graduated with honors from the Xavier University of Louisiana in New Orleans and earned his medical degree from Temple University School of Medicine in Philadelphia. His medical training includes a residency in general surgery from the Greenville Health System and the University of South Carolina, Greenville, and a fellowship in colon and rectal surgery from the Georgia Colon and Rectal Clinic in Atlanta, Georgia. He is a member of the American Society of Colon and Rectal Surgery and American College of Surgery. He is also a member of the National Medical Association, the Society of Black Academic Surgeons, Association of Healthcare Journalists, and the National Association of Black Journalists. Dr. McFadden regularly appears as an on-air health expert on both television and radio. He is currently a medical contributor to CBS WPSA 7 News in the upstate of South Carolina. He has appeared on CBS, Fox, NBC, MSNBC, and his advice has been featured in Dr. Oz's The Good Life, FoxNews.com, Essence Magazine, Reader's Digest, Shape Magazine, and blackdoctor.org. His blogs have also been published on kevinmd.com. He is a mentor to college students, medical students, and surgical residents. He is a Liberty Fellow and a member of the Aspen Global Leadership Network. Dr. Cedric McFadden lives outside of Greenville, South Carolina with his family. He is an avid runner and singer. Welcome, Dr. Our second panelist for today's event from the New Jersey Department of Labor and Workforce Development is Assistant Commissioner Dr. Cheryl Yarborough from the Office of Employment Accessibility Services. Dr. Yarborough is an industrial and organizational psychologist, program administrator, and researcher who is committed to strengthening services and economic outcomes for disadvantaged populations. She is a New Jersey native and obtained her PhD in industrial organizational psychology from the University of Central Florida in 2007. Although Dr. Yarborough has worked in various government and public sector roles, her career has consistently been focused on leading continuous quality improvement efforts to strengthen and promote effective educational, workforce development, employment, and child welfare services. Dr. Yarborough joined the New Jersey Department of Labor and Workforce Development as Assistant Commissioner for Employee Accessibility Services in February 2021. Within the past 10 years, Dr. Yarborough served at the New Jersey Department of Children and Families as a Director of the Office of Quality and Assistant Director of the Office of Research, Evaluation, and Reporting. While there, she focused on building and assessing large-scale service delivery models, implementing and monitoring performance metrics, and developing innovative and sustainable approaches to support leadership and staff development statewide. She oversaw federal compliance initiatives, statewide needs assessments, the development and implementation of various statewide continuous quality improvement processes, and led the redesign of the agency's primary case review process for enhancing casework practice and outcomes. Before serving at DCF, Dr. Yarborough worked at the Heldridge Center for Workforce Development at Rutgers University, where she specialized in the study of workforce programs for people with disabilities, community college-based programs, statewide school-based programs, and industry-based workforce development programs for low-skilled job seekers and incumbent workers. Welcome, Assistant Commissioner, Dr. Sherrill. Our third panelist for today's session is Dr. Mark Amu, a registered pharmacist. Dr. Mark Amu received his PharmD from Auburn University. He went on to complete a community pharmacy residency with Bartell Drugs, a regional chain in the Pacific Northwest and the University of Washington. Following residency, he continued to work for Bartell Drugs as a staff pharmacist before returning to the main office to head the medication therapy management programs for Bartell. He is also a National Academy of Sports Medicine certified personal trainer and enjoys combining fitness and his knowledge of medications to support his community. Welcome, Dr. Amu. On behalf of the New Jersey Department of Labor's Black History Month Committee, I want to extend a huge thank you to our panelists for your participation in our discussion today. So let's get started. Dr. McFadden, let's start with you. Looking at your career as a physician and your area of expertise surrounding cancer, we would like to field you this question. According to cancer.org, African Americans are about 20% more likely to be diagnosed with colorectal cancer and about 40% more likely to die from it compared to other groups. What are some steps African Americans can take to lower the risk of developing colon cancer and mitigate the risk of dying from colon cancer?
So first of all, thank you for that question, and thank you for the opportunity to share today and for the invitation. I think colorectal cancer has taken a front seat over the past few years because we've recognized two things: that more younger people have been getting colorectal cancer, and we've recognized that Black people are getting, as you mentioned, the disease at higher rates and also dying at higher rates. One notable death was Black Panther star Chadwick Boseman. But if you go through history, we've seen that occurring throughout history as well, where younger Black people have been getting colorectal cancer. The challenge we find with colorectal cancer is actually preventable. Colorectal cancer is one of the few cancers that you can actually prevent from occurring. And there's a very simple test that can be used that can help reduce the risk that you will even get colorectal cancer. And that test is a colonoscopy, which is a test that not many people regularly want to sign up for, but it's a great test because during that procedure, we can find small polyps and remove them and prevent them from becoming things like colorectal cancer. So I think awareness and prevention is one of the key steps that African Americans can do that can reduce the risk of colorectal cancer. And we have to do one other bit of information. Not only do we have to do the test, we have to encourage our family members, our friends to get the test, and we have to share our family history because family history can also increase the risk of colorectal cancer. So if mom or dad, a brother or sister had colorectal cancer, you're going to begin screening sooner than the average person will. For all comers, screening begins at 45 years of age. So by the time you're 45, you need to have your first colonoscopy. And if that test is positive for any polyps, you're going to have that test done a little bit more regularly than that, probably every 5 years or so. Ultimately, if you have a family history of colorectal cancer, you're going to begin screening 10 years before that family member was affected. So if mom was 40 when she was diagnosed, you're going to begin screening when you're 30. Regardless of your age, if you have symptoms of colorectal cancer, such as anal rectal bleeding, changes in your bowel habits, belly pain, or unexplained weight loss, you also need to have a colonoscopy. So knowing that, I think a colonoscopy is one of the best things that we can do to help reduce the risk of colorectal cancer in the African American community.
Dr. McFadden, thank you so much. Thank you so much for that information. I know I learned a lot in that response, and I think oftentimes when we think of colorectal cancer, we don't really look at the preventative measures that one can take. So I really appreciate you highlighting that for the audience today.
Thank you.
My next question is targeted to Dr. Amu, who is a registered pharmacist. So Dr. Amu, according to the American Association of Colleges of Pharmacy, in 2019, Black pharmacists represented only 4.9% of all licensed pharmacists in the United States. What inspired you to become a pharmacist?
Yeah, no, I appreciate that question, Brahim. But first, I just want to express my gratitude for you allowing me to join the stage with those of you at the New Jersey Department of Labor and the other distinguished guests that we have today. Although I didn't spend much time in the state of New Jersey, I was born there, so I do hold it near and dear to my heart. But yeah, back to your question in terms of what inspired me, it truly was family, specifically my late grandfather on my maternal side. So, you know, my dad is actually a pharmacist as well, but he didn't really push me much to go into pharmacy. I spent some Saturdays with him in independent pharmacies growing up, but I didn't really ever feel like he was forcing me to go into that direction. And throughout college, you know, I was exploring med school. I put a little thought into pharmacy school, but again, not much. And it wasn't until I was around 19 years old, my grandfather passed away, that I was really taken aback. And I asked my grandmother, you know, what was the you know, the reason that he passed? What was the real reason that you know, led to this? Because as far as I knew, he was you know, a very healthy gentleman. And she told me that he didn't want to take his medication. So, you know, my grandfather was a diabetic, and I just got to the point where he was tired of taking his medications, and you know, he was kind of over that. And it really impacted me because my grandfather was the cornerstone of our family. You know, my mom is one of 8, so lots of aunties, lots of uncles on that side of the family, and he was the rock in the family. So to lose him because he didn't want to take his medications was tough. It was challenging for me, and that's kind of when that spark hit. That, wait a minute, you know, all he had to do was take his medications, and we could still have him here today. And so then you start asking yourself those questions. Well, who was that person talking to him about taking, you know, his medications? And you know, at that point, all I knew is that it wasn't me, but you know, there's nothing I can do right now to bring him back, but maybe I could be that voice for someone else's grandfather in the future to help them take their medications and prevent a similar situation from happening.
Mark, thanks for sharing that story. And I think the one thing that resonated with me is the idea of medication adherence. And we're going to revisit that part of the discussion with you just a little later in the presentation. So thank you for sharing that. I want to segue the conversation a little bit to thinking about Black health and wellness more through a holistic lens. So I would like to target this question to Assistant Commissioner Dr. Cheryl Yarborough. Your area of expertise involves organizational psychology and interpretation of data. I know you have some past experience with monitoring the effectiveness of mentoring, especially young African-American women. Considering the conversation surrounding Black health and wellness, what value would you place on African-American youth mentorship programs that focus on our African-American youth building relationships with older African-Americans within their own communities?
Okay, thank you for that question. And first, thank you also for including me here today to participate on this panel and to really just participate in this celebration. And so I'm also happy that you included mentoring as part of this holistic conversation for wellness. And if you don't mind, Brahim, I'd like to expand the conversation from youth mentoring really to expand it to academic mentoring and also workplace mentoring, because many of us spend actually more years in our lives in the workplace, in that environment, than we even do, right, in our formative years and in the academic. So I'd like to also talk about mentorship more broadly, because I really believe that it is an invaluable tool for the Black community. It can be a meaningfully placed relationship with a mentor and a protege can mean the difference for a protege being able to overcome barriers that may be institutional barriers, systemic barriers that we may know from history that have actually derailed many in their academic achievements as well as in their overall career achievements. So I think that it is incredibly valuable, but I also think that not all mentorship is equal. And so the literature really suggests that there are various factors that influence the effectiveness of mentorship and also influence the outcomes that are related to different mentoring experiences. And so within that research, there's also a lot of focus on mentor and protege characteristics, types of mentoring, amount of mentoring, all different aspects of it. But when I've looked back and thinking about it in relation to the African-American community, what I say that I've seen over and over again in the literature is really that in African-American mentoring relationship, there's often a focus on one component of mentoring, which is psychosocial support. And that's a natural connection, right? Within the culture, there's a natural tendency to relate to people and relate and identify trusted environments and feel comfortable to open up. Psychosocial support really encompasses things like role modeling, acceptance, friendship, and that type of mentoring has been related to building self-esteem, building career satisfaction, being able to identify coping mechanisms. But as you may have all experienced, when many people seek mentoring and participate in those kinds of relationships, you're really also looking for tangible outcomes. You want to graduate from college, you want to advance in your career, you want to see increases in salary. And that type of mentoring has really been found to be related to what's called career development, a separate component of mentoring. It can be used in combination with psychosocial support, but it operates differently and it is more likely to relate to these outcomes that we're talking about, those tangible outcomes that I'm talking about. And so career development really encompasses things like visibility, being able to identify challenging types of assignments, skill development, exposure, networking. And with those things, you'll again see those increases in advancement, see those increases in salary over time. It's not guaranteed, but it is more likely when you look at the literature. So when you take that as a whole picture, I just really would like to suggest when we're thinking about overall wellness and how within the African community we can use mentorship as a tool, I would say to anyone in the role of protege or in the role of mentor to understand what it is that you're looking for in that mentorship relationship and understand the goal and assess that relationship over time to see, is this relationship really offering all of the aspects of mentoring that I need, that I'm looking for, or is it not? The mentors would ask the same question. Am I providing both psychosocial support and career development as needed based on the goals of this person that I'm trying to support and help? And I would just also recommend that the literature also suggests that it may be difficult to find all of those needed components in one person. And so think about actively enhancing your mentoring experiences to create a mentoring network for yourself, to really expose yourself to different opportunities to gain both of the psychosocial aspect as well as the career development. So
I'm sorry.
No, go ahead.
I was going to say, Assistant Commissioner Yarborough, thank you for that information. And it's so unique that you point to the idea of mentorship not being just one individual, but various individuals who can contribute. I have a good friend of mine who often talks about raising a child. And as you raise that child, you just can't have one adult pouring into that cup. You need 6 adults pouring into that, mom, dad, grandparents, right? So it's just a collective effort. So thank you for that response. And I think, on the heels of mentorship, it actually segues to another one of my questions. And this question here is for Dr. McFadden. When you think about historical figures in medicine, and specifically Black physicians, as AC Yarborough just mentions, as we think about role models, what clinicians inspired you the most and continue to inspire you to this day, and why?
So that's a really interesting question, because growing up, I didn't have, the knowledge of the Charles Drews. I didn't have the knowledge of Dr. Williams and others throughout history that have really played really remarkable roles. When I think about who influenced me into medicine, it was Dr. Heathcliff Huxtable, right? And as comical as that may be, and obviously there's some different weight on maybe what that statement means today, but in reality, I think that goes to the point of understanding how representation and how it really matters, because that was the example of who I saw as a Black male doctor. And I think moving forward, I've been really inspired by the people I work with. I've been inspired by some of the other leaders of, the Society of Black Academic Surgeons that continue to do great work. But I do think we pause because we recognize that we don't have equal representation out in media or at the forefront. As I enjoyed Dr. Yarborough's statements just now, I mean, I think it comes down to representation and letting young people see not just Dr. Heathcliff Huxtable, but see the real doctors that are on the front lines that are making an impact in their community. Those are the folk that I still get inspired by. But we have a lot of work to do. And I think that, hopefully in the next, 30 or 40 years as futures, young people are making the decision to go into medicine, they have more representation that they can finitely say, I know this person, or I've seen this person, or my own doctor is a Black female or a Black male, and they don't have to look for television for that representation.
Dr. McFadden, thank you for that feedback. And I often, your response really harkens back to a saying I often hear. It's hard for the mind to conceive what the body hasn't experienced. And I think that really hits on the idea of representation. So thank you so much for that. Excellent point. So I want to segue the conversation back to Dr. Amu. When you think about your career as a pharmacist, what do you find the most rewarding aspect of your job as a pharmacist? That's number one. And number two, and I can repeat the question if needed, what are some challenges that you see disproportionately affect the Black community as it relates to medication adherence and compliance to their medication regimens? And Dr. Amu, if you can maybe just break down what medication adherence and compliance really, with the definition of that and what it looks like for a patient.
Yeah, absolutely. To answer your first part of the question, what do I find most rewarding? It's really being a voice for the patient when it comes to their medication, and an advocate for the patient and a supporter for that patient. Going back to that story of my grandfather, I really try to put myself in the shoes of, okay, what if this person was related to me? How would I want them to be taken care of? How would I want this conversation to go when it comes to their medication? So being able to fill those shoes and have those conversations with those patients by far is the most rewarding. I think having that that humanistic approach with our patients and speaking to each of our patients as if there are only one patient, I think helps break down a lot of barriers, and seeing that glow in their eyes when they understand more about their medication regimen is by far the most rewarding part about the practice. And then going into the second part of your question for medication adherence. So, medication adherence is essentially taking medications as prescribed by your physician, right? So adhering to the regimen that was prescribed by your doctor on a daily basis, or whatever the frequency for that particular medication is. And why that's so important, there have been numerous studies to demonstrate that patients experience better outcomes from whatever disease state we're treating when they are more adherent to their medication regimen. So it's essentially the most important thing when it comes to pharmacy, ensuring that our patients are taking their medications appropriately. And the second part of that question, what are the challenges that Black pharmacists, or excuse me, the Black community faces when it comes to medication adherence? I think I would, echo Dr. McFadden's testaments in terms of representation. Having that conversation with the patient about taking their medication appropriately really takes a deep level of trust, right? And you're only going to be able to form that trust if you have a great relationship with your patient. If there's that lack of representation, within pharmacists who are having these discussions with their patients more often. They don't see someone who looks like them across the counter. It's just going to make it that much more difficult to break down that barrier of trust and have these conversations with these patients on why it's so important to take their medication as prescribed by the physician. So I think, again, echoing those sentiments, increasing representation within pharmacy. You mentioned it earlier. Only 4.5% of licensed pharmacists in the U.S. are Black. So, the majority of Black patients who are going into the pharmacies aren't seeing Black pharmacists, and it's just adding that extra level of or an extra hurdle when it comes to having these discussions of medication adherence.
Thank you, Dr. Amu. And I think when I think about patients taking their medication, I think one demographic that kind of stands out is the idea of Black mental health. And I know since the COVID-19 pandemic that's got a lot of focus. And I want to kind of explore that, do a little bit of a deeper dive. And so I want to address this question to Assistant Commissioner Dr. Cheryl Yarborough. Oftentimes, African Americans don't address our mental health concerns or issues. What do you see as barriers to members of the African American community seeking supportive services to address issues affecting their mental health?
Okay, thank you for that question. So I think there are several barriers, and I'll go in and talk about what I see as some of the barriers. But as I go through the list, I want to also note that I don't see them as insurmountable in any way. They've been there, they may be difficult, they may be there, but they're not insurmountable. I think one of the largest barriers that you hear and talk about is related to the stigma in the African American community related to seeking help, and particularly related to seeking help related to mental health concerns. There's a perception that within this community, we overcome, we're persistent, we're strong, and the idea of seeking mental health can be viewed as a weakness, and meaning that you can't handle your situations. And so it demonstrates kind of that lack of strength in your being. And so that's hard when that's part of your culture and part of who you're told who you are, to be able to offset that for many individuals. There's also a lack of access to finances and maybe insurance needed to be able to access some counseling services. There may be limitations in availability in local areas. I think another big barrier is that there are oftentimes perceptions that a counselor, particularly a counselor of another race or of another background, may not be able to relate to the needs of the individual who's looking to seek help but is hesitant, and may have kind of an established distrust for some medical providers and for seeking that kind of help. The idea of seeking help in a relationship that's not fortified, trusted relationship, but is with a stranger, is outside of kind of the cultural norm within the Black community. But I do have some hope that I feel like I'm seeing a shift in some of the conversations around mental health within the African American community. I'm very thankful for those who have large platforms who have been speaking to this issue, but I also think that there's day-to-day conversations where there's a shift, and I think we can do more with that by being careful in how we react when folks talk to us about their mental health concerns, right? How we kind of carry our body language and be ready to listen and open. And also, I think it's important for those who have successfully sought treatment and identified help, for them to be open where they can with others about that, so that others can know that there might be some resources in your local communities that are really effective. In regard to overcoming access issues, one good thing that's come out of these last few years is we've all gotten more comfortable with virtual platforms like this one. And so you may have more access to virtual services that weren't available before. And so you can expand your network of potential therapists or counselors that can support you. I think another important area that I've seen in the mental health provider side of things is that there's a recognition of a lack of culturally appropriate services and a want to be able to address that. Now, I'd like to see it more. I'd like to see cultural appropriate services be really highlighted and held up as an expectation and a standard across the board. There was early conversation or several years ago really talking about, it probably still exists, but around cultural competence. And when you think about that, to be competent culturally, especially when you're serving diverse needs of various different clients, it could be very difficult. But at the very least, we would call on medical providers or counselors, therapists, to really engage in cultural responsiveness and humility to be able to support the African American and other minorities as well. I would say the last piece around barriers too is to advise people who are seeking services or hesitant about seeking services, is that once you engage in a service, if it's not comfortable for you, if it doesn't fit, just like within medications, you can get support and identify strategies to change that and to find something that does better suit your needs, and to really see yourself as an advocate for your mental health, and understand that the persistence that you need to have in that regard is just as important as the persistence you would have if your leg was broken. That's what I'll say, because that's something that you can see and feel, and you want to hurry up and see it heal. Well, in the same way, you should have that focus for your mental health.
Thank you, Assistant Commissioner Yarbrough. And I think the two words that kind of just stuck out was the idea of cultural competence and the idea of trust. Actually, patients, having some trust as it relates to the clinicians that treat them. I often utilize the phrase that trust is earned, it's just not innately given. And I think that's something in the healthcare arena that practitioners really need to focus in on and contemplate. Spend a little time on the idea of trust. So along those lines of building trust, I want to ask Dr. McFadden the following question. So looking through a historical lens of medical racism from the Tuskegee experiment of 1932 to 1972, and the sterilization and eugenics program, which occurred in North Carolina from 1929 to 1974, and many other states as well. Specifically looking at North Carolina, it's estimated that over 7,600 men and women were forcibly sterilized, and many of these individuals were Black men and women. When we consider the history of medical racism in this country, how can healthcare practitioners provide healing to the Black community, which continues to distrust many within the medical community?
That is a very loaded question, right? And I'll try to address a couple of the highlights of that. I think a big part of our responsibility as a medical community is to acknowledge. Often, if you don't acknowledge there's a problem, you can never move beyond it. So I think we have to acknowledge, and fortunately, we've started to see some of that acknowledgement over the past several years by several of this national medical societies and organizations. But I think it takes a little bit more than just acknowledging it. We have to then say, well, how is it then affected not only the care that we give, but the people that choose to provide that care? So we go back to people choosing to enter into medicine, and subsequently how we deliver that care to our patients. I think we recognize that then may influence the healthcare disparities that we see. We've talked about the higher rates of colorectal cancer, but you pretty much name it, they're going to be disproportionate amounts of influence present in the Black American community as opposed to their counterparts. And so we have to acknowledge how those then social determinants of health then influence the numbers that we then see. I also think that representation continues to show up in this space as well, where we have national organizations having a lack of leadership by people of color. And that has to be corrected. That has to be something that we have to identify to move the needle on. So it's not just apologizing. it's more of acknowledging that this is indeed, instead of kind of pretending like it didn't happen, it didn't really matter, but we have to say it did happen. And we then have to have the conversation about how do we then move forward in a way that's productive to not only our own societies, but also to the patients that we take care of and the healthcare that they receive, and eliminating many of those diseases that we take care of so often.
Thank you, Dr. McFadden. I think you bring up a very valuable point when we think about the pandemic, and we have a focus now, or I should say an increased focus on health equity as well as healthcare disparities. The pandemic has really highlighted the disparities within the Black community, and I think that's an excellent point to bring to the forefront. I now want to kind of segue the conversation around COVID. We are all living in these COVID times, and I want to just ask some questions of the panelists, some thoughts around the COVID-19 and what we can do as individuals of the Black community to navigate through this time that is affecting everyone, right? Affecting all of our families. So I will target this first question to Assistant Commissioner Dr. Cheryl Yarborough. Considering your psychology background, what advice would you give to individuals who have noticed a change in their mental health during the COVID-19 pandemic?
Brahim, when you first started, when you were talking about the pandemic, and I'm thinking about this period, I think, and because we're talking about the African-American community, I think it's important that we note that during the pandemic period, in addition to addressing all that came with COVID, right, the changes in our daily lives, the loss that we endured, there's also been this period of national cultural reckoning that for many of us has really brought to the forefront challenges related to racial trauma that we've experienced over the years. And so when I think about the African-American experience during this pandemic period, I really think holistically about both. And it doesn't then surprise me that many would feel higher levels of anxiety, feel overburdened, feel additional stress, maybe even various mild depression as well. And so I would say that if someone were to start to see some changes and start to recognize some things in themselves, I would really recommend that they focus in on real purposeful self-reflection, identifying the degree to which those symptoms are really interfering with their day-to-day functioning, because there can be different levels, right? You can have some mild symptoms where you feel down, but you're really able to function. You may feel like confused about things, feel levels of anxiety, but you're able to move forward. And if you were to see these kinds of symptoms persist for 2 weeks or so, or for an extended amount of time, I would say that within that self-reflection, that you really identify what you can do to kind of increase your own self-care on a daily basis. So, having these thoughts of anxiety or things like that may have been leading you to eat differently. Maybe you're not sticking to a good, healthy sleep schedule. Maybe you're foregoing your exercising and you need to kind of get back to that. Maybe you're having a lot of feelings and things that you need to be able to talk to someone. So you need to be, you need to reach out to your trusted social network to be able to talk about those things. But if you are in a place where it's really more than that, it's really more than those mild symptoms, and it's more severe in that you're not able to sleep very well at all, or things that interested you before are just not interesting you, that you feel yourself distancing from family and from those whom you trust, and that persists over an extended amount of time, let's say more than 2 weeks or so, then I would really recommend that you seek professional help and that you don't go at it alone, because there's so many resources out there that individuals don't have to do it by themselves. And if you have a trusted family network or informal network around you, that you lean in on that support network. There are large organizations that provide help, like the National Alliance for Mental Illness or SAMHSA, Suicide Prevention Hotline. There are smaller organizations that focus on targeted help and resources for individuals. There's the Association of Black Psychologists, You can look for therapists in psychology today. You can find therapists in, I think it's blackmentherapy.org. And so there's a lot of different avenues where you can seek help, and you should do so. And then I would say, when you think about this time where everyone is affected, it really would behoove everyone to really include self-reflection. And since we're talking about wellness, particularly around wellness as a daily routine and a daily way of operating. And so I would suggest taking purposeful time to check in on your own self and say, how am I doing? Am I really functioning in the way that I intend to, in the way that feels comfortable for me, in a way that I would define as me being well? Or am I not? And if I'm not, then what areas of my life are impacting that feeling? And then break down those areas for yourself. You can even identify those key areas and write them down. Some of the domains around well-being: is it my spiritual well-being that's an issue here? Is it my emotional or psychological state? Is it my financial well-being? Is it something in my environment that's just not comfortable for me, and I just can't I can't be happy in this space? Is it related to your occupation? Is it your physical health? Are there stressors that are really beginning to show up in your physical day-to-day? And so I just encourage that during this period, again, if you're seeing some signs, monitor them for yourselves, identify how much is influencing your daily functioning, and then take that monitoring kind of behavior and just incorporate it in your daily life.
Thank you, Assistant Commissioner Yarborough. I think providing a holistic approach to self-care is definitely paramount during the pandemic. I think sometimes we lose focus on what we need as individuals as it relates to our own well-being. We tend to maybe focus on others, our little ones, our family members. So I think that dedication to oneself is definitely an area to highlight and focus. I want to segue the conversation now with a question to Dr. Amu. You are a licensed fitness trainer as well as a pharmacist. So I like to pose this following question to you. The COVID-19 pandemic has disproportionately affected Black and Brown communities. According to the Kaiser Family Foundation in 2018, 11.7% of African Americans in the United States had no health insurance, compared to their counterparts, 7.5% for white Americans and 6.3% for Asian Americans. For anyone struggling with mental health or other ailments, what steps do you suggest they take to seek as it helps What steps do you suggest they take to seek help as it relates to physical exercise and medicinal treatments?
Yeah, thank you for that question, Brahim. Kind of as I think about that, I'm also thinking about Dr. Yarborough's comments that I really appreciate. I think doing those self-reflective exercises are pivotal before you embark on any new journey, whether that's with your physical exercise or going to seek medicinal therapies, what have you. It's invaluable, very important, and I appreciate you, Dr. Yarborough, sharing those comments. But then also the second part of that, not to undertake any of those things alone. I think specifically when it comes to physical exercise, oftentimes we think, okay, well, I need to get going and maybe I need to run my first mile, and then I'll go and find a trainer, or I'll go and find a fitness class to undertake. But there's definitely no need to do that alone. I think before you undergo any exercise routine, first thing you need to do is speak with your primary care provider and make sure that you're healthy enough to do those activities. But then from there, reach out to your community, reach out to others to see some of the things that they're doing. But the most important thing that I encourage folks to do when they're considering undergoing an exercise routine is really to start small. You don't have to jump into running 5Ks your first week of working out. One of the first recommendations in many of the disease states that we learn about in pharmacy school to do is lifestyle modifications. And when they talk about physical activity, that initial recommendation is usually 30 minutes of moderate exercise most days of the week. And that 30 minutes of moderate exercise can simply be walking. So if you haven't started an exercise routine, or you haven't done one in a while, just walking for 30 minutes a day most days of the week can significantly increase your overall cardiovascular capacity, but it also has several benefits on your mental health as well. And so, that's the biggest thing that I encourage, no matter what no matter where you are on the fitness spectrum. Don't think that for someone like myself, who was an ex-retired high school athlete, and thinks that, oh, I need to be able to do this or I need to be able to do that. By no means is that the case. Starting small, just going on a light walk most days of the week can have huge benefits. So that's usually where I would encourage people to start.
Thank you, Dr. Amu, for that feedback. And you mentioned cardiovascular health, and that is definitely when I think about a disease state that affects the Black community, hypertension just comes to the front of my mind. I know individuals in my family have had some troubles with that, So thank you for highlighting that, and some ways to mitigate that as well. And kind of coming in on the heels of that, Dr. Amu, I want to present this question to Dr. McFadden. In our previous presentation on Black History Month on February 1st, our Assistant Commissioner, Tennille McCoy, from the Division of Human Capital Strategies, highlighted the CDC has stated racism, both structural and interpersonal, are fundamental causes of health inequities, health disparities, and disease. The impact of these inequities on the health of African Americans is severe, far-reaching, and unacceptable. What are your thoughts surrounding the impact of the manifestation of disease states such as hypertension in correlation to systemic forms of racism and oppression in the Black community?
I mean, you think about diseases, you mentioned hypertension. In my world, I treat colorectal cancer. If you have a system that is set up to where you don't have access to either clinical trials or to medications or therapies or treatments that would otherwise be profitable to your health, then you're going to be at a disadvantage. You're not going to have the same success. We've seen that data with colorectal cancer, where patients, if we correct the imbalance of not being offered the same chemotherapy, that patients actually do well. They do better than they do otherwise. And so when we recognize that there's a difference in the way Black folk respond or have results with colorectal cancer versus their counterparts, if we can correct a little bit of that imbalance in the treatment options that may not be given, that can improve the outcomes. But systemic racism doesn't just show up in that, is also showing up in how well you are able to talk with your doctor. The conversations that you have with your doctor, is it plain language that you understand them, they understand you? It also goes into the fact of how well you can get to the doctor's appointment, or if you are on a job where you're a frontline worker, do you have paid time off to get to the doctor? And do you have childcare to get to the doctor? And there's so many layers to that. It's not a single fix, but I do think it will then affect the outcomes of diseases, the number of people that require medications, how long they're requiring medications, and it's even the effectiveness of those medications, because if you can't afford the medications, then we're fighting a losing battle. And it's quite discouraging to have a patient say, well, I would take this, but it's too much, or I don't have the insurance, I don't have costs. How have we built that in to be supportive of our communities? So I'm grateful for this forum, because I do think it continues to expose the challenges that we have, but I do think it brings it to the forefront of our minds so that we can continue to work to make actions that can improve our health and the health of our communities.
Thank you so much, Dr. McFadden, for that. I just listening to your response, the one word that just kind of echoes in my head is the idea of change agency, being a change agent. And with that as a backdrop, I'm going to ask our last question for the panel. This is going to be directed to Assistant Commissioner Dr. Cheryl Yarborough. When you reflect on your career in state government and your role as a change agent, what are some of your biggest achievements that have directly or indirectly impacted the African-American community through a wellness lens? Does any particular achievement resonate more than others?
I would say for me, my biggest achievement, I don't know if I would ever get an award for this, but my biggest achievement is really recognizing my passion and recognizing that I've been trained to be able to examine programs and to research and understand factors that are associated with services that are provided to marginalized populations. When I first came into the area of psychology, I thought that I would ultimately be part of or contribute by participating in directing programs and actively participating in programs. But when I realized that my background in understanding how organizations operate and understanding measurement, I realized I could do much more if I pulled programs apart and study them to understand both the factors that influence those who are providing the service and the factors that influence those who are receiving the services, and to be able to look at those outcomes. And so over time, I really am thankful that I've been able to use that lens to be able to analyze data within child welfare agencies, within the Department of Labor, and in analyzing it, pull it apart and focus on racial disparity as part of how we look at data every day, and to incorporate that into the conversation with leadership to be able to talk about how we can hold ourselves accountable for identifying ways to enhance how we operate, how we support those who are providing services, and how we actually serve, and the outcomes that we end up achieving with those that we're intending to serve. And so for me, I think that is one of the greatest things that's happened in my career, is that I really understood that I'm able to use my focus on data in a unique way, but to be able to change systems and programs overall. And what I hope is that the folks that I've worked with and those that I've mentored and who have helped me analyze data and ask those questions and circulate that information around the state, I hope that I've helped to build their capacity and that they'll continue that work to be able to look at racial disparities in performance and in how we provide services as state agencies.
Thank you so much, Assistant Commissioner Yarborough. And I want to let everyone know in attendance today, this concludes our program for today. So I want to extend a warm thank you to all of our panelists, Dr. Cedric McFadden, Dr. Cheryl Yarborough, and Dr. Mark Amu. This was a very insightful discussion. And for our audience members in attendance today, I hope you found the discussion meaningful and you walk away with information that benefit you as well as your families. It's been a pleasure participating in today's event. And I hope this diverse array of panelists has inspired individuals watching to understand that Black health and wellness extends beyond routine office visits. Black health and wellness starts with each of us educating those in the Black community to increase our level of healthcare literacy and supporting those in our community who face obstacles negatively impacting their health and wellness. I will now pass it over to the Black History Month Committee Chair, Ulysses Anderson. Ulysses.
Thank you, Brahim. And I want to extend a heartfelt thank you to all of our panelists, Dr. McFadden, Dr. Yarborough, and Dr. Amu. We really appreciate the time you have spent with us here at the New Jersey Department of Labor, and especially the Black History Month Committee. And